Dear Kenyans, as of this morning, the global coronavirus statistics indicate that the number of those who have succumbed to the disease is 2,760 people. This number continues to rise. The same applies to the number of those that have so far tested positive for the disease, which currently stands at 1,700,435 people. And this number is very quickly hurtling towards the 2 million mark. Out of this, 480,000 people have recovered. These are our brothers, sisters, fathers, friends, relatives, and loved ones. Fellow Kenyans, when we consider that this weekend marks our 100 days since the first case of COVID-19 disease was reported, we begin to realize that globally, we have been losing at least 1,000 persons daily. These are no mean figures, and it is more the reason why we should continue to observe the measures as advised by the government. Fellow Kenyans, we are breaking down these figures so that we can show you in clear terms the danger that is facing us. To relent even just a little in complying with government directives that have been so far been issued is to invite mass deaths. We therefore continue to appeal to you to uphold these measures and to ensure compliance by yourselves and all those around you. We continue to applaud the initiatives by county governments to combat COVID-19 virus. I'm delighted to announce that the number of isolation beds in our country is increasing day by day, thanks to our county governments. We encourage all county governments to continue upscaling capacity at all county health facilities to fight this disease. I would also like to caution everybody that this is not the time to engage in politics with donations that have been given by well-wishers or corporate entities. Fellow Kenyans, since our last briefing yesterday, we managed to test 491 samples. Out of this number, 2 have tested positive for coronavirus disease, 1 in Mombasa, 1 in Nairobi. This now brings the total to 191 cases of confirmed cases in the country. One of these cases is a Kenyan and the other is a foreign national. None of them has a recent history of travel. The 2 cases were picked by our surveillance teams, and one of these cases is aged 2 years old and the other is 32 years old. Today, 2 more people have been discharged from hospital. Cumulatively, this now brings to 24 the number of Kenyans who have recovered and been discharged from our health facilities. As we continue to celebrate Easter holidays in our homes, let us reflect on what we must do in order to contain the spread of infections. We must remember to wash our hands. We must remember to continue observing social distance. We must continue to wear our face masks, and we must continue to stay at home. What we do know, however, as we try and scale up mass testing, we are bound to get more cases of coronavirus within our population. And so the next 2-3 weeks will be very important for us as we first start with targeted testing of the quarantine centers, then for our healthcare workers, and then rolling out the mass testing in the different institutions. Again, it's important to note that we are looking at our different laboratories within the country. I'm glad to announce that we are scaling up and more laboratories are engaging in the testing exercise. We do even hope perhaps in the coming 2-3 weeks to engage some of our facilities that have been testing for TB across the country. Almost 193 machines that are available. So this is a case-by-case issue that we are looking at, and we do see that mass testing will indeed pick out the positive cases and will then be able to combat coronavirus disease.
In terms of mass testing, yes, we have received kits from Roche Diagnostics, enough to be able to test 7,000 persons. And we will be able to deploy this in Kemri, where we have 3 machines. We have another one at Kenyatta National Hospital, a 4th one at the National Influenza Center, another one at Moi Teaching Referral Hospital, then the 2 last one at Kemri Lupe and Coast Provincial Hospital. So as we prepare for mass testing in the next 2-3 weeks, this is what we are going to deploy. And the beauty of what we are going to deploy is that now we'll be able to do more tests in a shorter time. The Cobas 8,800 machine can be able to do 2 to 3,000 tests in about 1 to 2 hours. So in about 2 hours, we can be able to test 2,000 to 3,000 Kenyans in one facility. So if you multiply that by the number of sites that we can be able to deploy, then you can see it's a huge, huge potential. Yes, Foreign Affairs issued a statement on behalf of the government regarding the situation of Kenyans in China, and our embassy in China, of course, through the local Chinese embassy and the ambassador here, we are in discussions to ensure that Kenyans who are in China are protected and their rights are not violated because of COVID. The same way we protected the Chinese here, we expect them to reciprocate and ensure the safety of Kenyans who are in China.
Projected that the numbers would increase, but as it stands, yesterday we had